Yes, hello everyone. Today we have Dr. Vaishali Joshi with us for Pragyan 3. Pragyan is just our humble effort to l- share the learnings of our beginners, people who have just started using PEM and they are able to work out through the PEM concepts. So it is just our effort to share and show that how beginners are also able to apply the concepts of PEM with their own uniqueness and with their own creativity. So over to Dr. Vaishali.
So, hello all, and sorry for the delay because of some technical issues. Now, I would, without wasting further time, I would just start with my presentation. I am Dr. Vaishali Joshi, and I am basically a classical homeopathic practitioner, taken training in ICR, and I practice the ICR way. And I would like to share my experience about homeopathy and how did I come into this PEM method. So basically, I have been practicing with the classical method, and I had this uh, adaptation of picking up different tools which would lead to similiimum. And when I came across this PEM method, I found this also very interesting. And by using this PEM method as one of the tools to reach the similiimum, so I found that PEM method opens a wide range in materia medica with respect to number as well as the depth of the medicines and the remedies that we know of. So that would lead to a very good DD of remedies which are possible at a very finer level with various facets available through PEM application. And at the same time, I felt that even the prescriptions become very confident. We are not into any dilemmatic state that if the remedy is right or not, or something like that. And PM also leads to more clarity of a particular remedy in depth, unfolding the areas unexplored. So many times there are so many things that we do not know about the remedy, which we come to know by this PEM method. And again, I find that PEM approach abides to Hahnemann rules and laws of nature, and it's very user friendly in application. So going further, I would just like to say that this case which I have selected today highlights the importance of common themes running in the remedies belonging to one family, and subsequently the possibility of remedy selection through differentiation by prominent physical symptoms that stand out as PQRS for that particular patient during that disease process. So this case also depicts that many a times the similiimum is sought by referring to materia medica sources after arriving at a set of remedies with repertorization. The application of various tools like repertorization filters, the kingdom classification, the Yakir's plant chart or family themes, etc., is then done to differentiate the remedies from their finer aspects. So Dr. Mahesh Gandhi sir's PEM method proved very handy in this case, without which I could not have given the similiimum. I would just outline in brief about the PEM way before I go to the case. So the personal evolution model, which is the PEM, is a new paradigm which is introduced by Dr. Mahesh Gandhi sir for homeopaths, emphasizing a balanced use of both the brain hemispheres to understand patients and their illness better. Both subjective and objective approaches are to be equally used in order to find out the reason behind the illness. That is, to look within for answers to solve the problems visible outside. In homeopathy, we treat this inner state to restore the health. Now, this case depicts how many a times the similiimum is sought by referring to materia medica sources. Then the two hemispheres of brain with right brain approach as analogy and the left brain approach as causality. both opposite poles to each other. Now, analogy looks for similarity between dissimilar things and concentrates on the common content of this whole range of dissimilar things through abstraction. Now, whereas causality looks for the sequence of the effects, leading to greater differentiation. Life is a duality, and therefore, both the approaches together are needed to interpret this. Now, if everything goes through the evolutionary journey, including human beings, then one needs to find out which animal or plant or mineral shares this same evolutionary stage with a particular human. Now, we already know how every human being is different from each other, and each one represents a different stage of evolution. Now, this model attempts to see the similarity of the abstract patterns of minerals, plants, and animals in humans as per the evolutionary understanding. Now, Dr. Mikhail Yakir, an Israeli botanist, has done extensive work on the plant's taxonomy. And Dr. Mahesh Gandhi sir has drawn similarities from Dr. Mikhail's work to correlate each subclass of the plant chart with the periodic table of mineral kingdom and the developmental stages in humans. Now, these stages help in differentiating the various orders of the same subclass as per the degree of their development. Now, the issues are the same in a particular subclass, but the way of dealing with it differs from person to person depending on his psychosocial developmental stages. So, for kingdom understanding, in general, patients who need mineral talk about themselves and their capabilities as regards to adequately function in the world. In patients requiring plant, will focus on what the world does and how it affects him, basically the sensitivity to environment and its reaction to it. Now, a patient from animal kingdom will focus more on what the world does to him, resulting into he being an aggressor or a victim. That is concept of I versus me. Now, with this brief introduction of PEM method, I would like to proceed to the case. So now this patient of mine had come to me for his acute renal colic in 2021. And he was a known case, he's a known case of recurrent renal calculus since his age of more than 13 years. So now he comes on 3rd of March 2022 with the complaints of orchitis. He is a 35 years old male who is residing in Navi Mumbai, Maharashtra, India. And he comes down with the complaints of severe swelling and heavy sensation of pain and severe pain that is radiating to the penis from the left testis. And there is this heavy sensation, the pain is continuous, severe, intense, and occasionally of a pricking type. He has this sensation of tightness, which is increased on walking, on riding a bike, on doing any kind of exercises. And along with this complaints, he had come down with painful vertebral pains, painful vertebra, and a very marked weakness. And he had also distension of abdomen, which was again very marked 3. Along with this, he had this kidney complaints always. That is a colicky kind of a renal pain which goes to his legs and below. It starts from the pelvis and goes to the calves. As already mentioned that he was a known case of bilateral renal calculus, he always off and on came down with this renal colic which was aggravated on walking and on riding the bike. And again, along with this complaints, he would always have very marked weakness and distension of abdomen. So this went again along with this complaint too. And in past, he is having bilateral renal calculus, and he also had left inguinal hernia of degree 1. In his family history, his father had expired due to chronic renal failure at a very young age. And the mother is healthy. Now, patient as a person has a good appetite, which is normal. He craves for spicy things, whereas nothing specific in aversions. He has occasional painful micturition during the chief complaints. His sleep is deep for 4 to 6 hours and always disturbed due to complaints. Otherwise, he sleeps well. Nothing specific found in dreams, and thermally he was chilly. So this was his personal information. Now, in his life space, what was found was patient came from a middle class Maharashtrian family with widow mother, spouse, and 2 daughters. He lost his father when he was 10 years old. He studied till 10th standard and got into the vegetable vendoring business his father had left. Now, many a times he used to get this thought that he had to work for the livelihood when others of his age studied and enjoyed life. But then he continued to carry out his responsibilities, and today he is well established in the business, earning well and supporting his relatives too, along with his own family. He is very cautious, observant, and intelligent in his business dealings, though he is not that educated. But in spite of that, he manages to do his dealings well. But at the same time, he is very sensitive, he is very naive, and very caring in his relationships. He goes out of his way and helps everyone. He does not feel that, oh, he is my cousin or he is my neighbor. He does not do any such distinguish. And if he comes across any person who is not happy, who is not doing well, he would go out of his way to help him out. But at the same time, he is also very irritable, fearful, and anxious when he falls sick. Even with smallest of complaints, he becomes highly irritable and highly anxious. He always feels that even today, that if his father would have been there, then the situation would have been different. He would handle everything and everyone well. In spite of he doing well, he always has this feeling that he cannot handle it and he needs somebody. He always reaches out on some support system. So, and when he falls sick, that troubles him a lot because he always gets into this anxiety that what is it that is troubling him. Even if it is a trivial complaint, he feels that what severe ailment is he suffering from. So his mental state would be like he would not want to do anything. He immediately resigns on everything and he would just lie down for the whole time. There is a constant fear that what will happen to him? What is this illness? Is he suffering from something very serious? He gets irritated at smallest of things and asks everyone to leave him alone and not to bother him. On physical examination, his temperature, pulse, and blood pressure were within normal limits, with no local examination done. His clinical diagnosis was orchitis with mild epididymitis. So, the totality was formed, and as I used to practice, I practiced the contemporary method of classical way. I had formed the totality and I repertorized the case. So the totality goes excitement, excitable, ailments from aggravates, excitement, excitable due to pain, anxiety, suffering of, fear, impending illness of a serious, fear of dark, delusion, betrayed he is, company aversion to, alone desires to be in suffering, left-sided complaints, weakness plus 3 marks, and organ affinity is kidneys and genitourinary tract. So now, on case analysis, patient is highly affected by any kind of illness, that is smallest to the serious one. He becomes anxious as to his complaints and is worried about his sufferings. He had shared with me that even if he has slightest of some chest pain, and if it happens to be even somewhere in the center or a little on the left side, he would always feel that is that he's coming up with some heart complaint or something serious, and he would rush to the cardiologist. So if he had told me that probably in every 2 months or 2.5 months, you would have one visit of a cardiologist, and the cardiologist would every time tell him that there is nothing wrong with your heart, it is absolutely normal. So this is how he used to function with smallest of trivial ailments. He is very naive person, worries and cares for everyone, depicts oneness with everyone, Fearful and excited out of anxiety is also marked. He speaks about various things affecting him. He is sensitive to everything around him and has very specific reaction pattern. The patient exhibits plant energy. See. Now I would talk a little about plant kingdom. How does a plant energy show itself? They are sensitive to environmental changes. Something from outside excites something within. Sensitivity is expressed through sensations and reactivity along with adaptability, which is the compensation. Now, the sensations and reactions are available in chief complaints, physical data of pathology, dreams, and emotions. Ample modalities available as most of the things affect them. A single basic sensation is present along with other sensations synonym to it. Opposite sensations of the basic sensation is available, that is the polarity. And reactivity is in the form of active and passive reactions. Now on repertorization, on the repertory chart, the prominent drugs that came up were carcinosin, phosphorus, natramure, cocculus, staphylos aureus. Now, carcinosin, though it covers the major totality, the core of carcinosin comes from domination, which was missing here. In phosphorus, though the remedy came very close to the patient and it is strongly kept as one of the close coming remedies, it also covered weakness due to the complaints. But excitement during pain is not covered by phosphorus, which was one of the very prominent symptoms in our patient. Natramure does not cover the excitement due to anxiety and fear of the illness. The irritability due to pain is also absent in natramure. Then cocculus, the themes of patient score is covered by cocculus, but the excitement during pain and aversion to company was not covered by cocculus, which is again a prominent expression of patient during illness. Staphylos aureus, this remedy also comes very close in themes of the patient, but it does not cover the prominent feature of excitement during pain. So Staphylos aureus is again in dignity, hence it will tolerate the pain and not show this irritability. Now, cocculus and Staphylos aureus, I would tell you the journey of my journey of going to the remedy. So, as I had already identified the plant energy, I came up with I identified the two remedies of plant kingdom, that is cocculus and Staphylos aureus, which were coming up, and they both belonged to ranunculales order of subclass 1 of the dicots. So let us see something about the subclass 1. Subclass 1 people are very primitive. They are unable to handle or deal with the material world. Hence, they are naive, innocent, childlike, trusting everyone. They have this feeling of oneness, felt with everyone, wants to remain in this experience of oneness. Their boundaries, they are unable to understand the difference between self and others. No boundaries are perceived by them. Everything penetrates easily. Lack of awareness and weakness of mind result to unexplained fears and anxieties. They prefer to run away from problems rather than face them. Reaction is withdrawal into own shell or protected, sheltered, enclosed space. They have a weak ego, which is insufficient to hold the emotions. Therefore, they become impulsive, anxious, gluttony, high sexual drives, addictions. They are influenced easily by everything. Incomprehensible emotions like irritability and touchiness are found in them. They are very oversensitive to light, pain, and external impressions. State of oneness, unity, and wholeness is something that we find very sharply in subclass 1. They are bound to divinity from the innermost level. Chaos and lost, confused, bewildered feeling is something which runs in this subclass. Hence, they have this weak and dependent kind of an attitude. Adaptable to any situations. In spite of all these confused, bewildered, weakness, dependency, they have this quality of adapting immediately to the situations that they fall into. The sensations commonly found in subclass 1 are confusion, bewildered, beclouded, withdrawal. The active reaction usually is withdrawal and isolation. The passive reaction is sleepy, stupefied, collapse, fainting, unconscious, and the compensation is they adjust to the new strange situations. Now, ranunculales, cocculus, and Staphysagrina came from ranunculales. Ranunculales have three families, viz. Ranunculaceae, Berberidaceae, and Menispermaceae. Now, cocculus is from family Menispermaceae and Staphysagrina is from family Ranunculaceae. Menispermaceae family has marked prostration, inability to stand up to the world for long periods. The ego is not matured enough to form a center. Therefore, they fall out of balance, becoming sluggish or even lazy. So, after reading this Menispermaceae, I had read other remedies from this order. And from this family, other than from the family that cocculus belonged to, Pereira brava was yet another remedy which belonged to this family of Menispermaceae. And along with the themes of the patient, it also covered the marked weakness and the excitement during pain with aversion to company. The organ affinity with left-sided complaints is also covered very well by Pereira brava. Now, the susceptibility was complete psych and soma correspondence. The susceptibility understanding is the complete psych and soma correspondence of remedy with patient, very high sensitivity marked. Characteristic symptoms are available. Reactivity and vitality is very high. History of recurrent kidney stones available at physical level and signs and symptoms available at the physical levels again. Therefore, low potency to be given frequently. Hence, the final prescription was Pereira brava 30, 3 times a day for 5 days. This was on 3rd of March 2022. Now, the next follow-up that comes up on 10th of March 2022 with soreness all over the abdomen, conjunctivitis marked 3, weakness marked 3, pain, aggravation walking, aggravation touch. There was tenderness, unable to wear his pants. So I raised the potency to 200. And on 17th, 200, Pereira brava 200 given TDS for 5 days. So after 7 days again, on 17th of March, his swelling had improved almost 70%. The vertebral pain only at night, which was better 3 marks during daytime. And the weakness was better 50%, more than 50%. So I continued with Pereira brava 200 TDS for 5 days. And on 24th of March, all complaints were better by 90%. And he was given placebo. After that, Pereira brava was helpful later in complaints of hydrocele. He had come up with a hydrocele complaint also later in October 2022. Even that time, Pereira brava helped. And when after that, in renal colic also in 2023, Pereira brava used to help him, and I used to give him single doses, not this frequently. So this was my experience of Pereira brava, which I never knew this remedy, but through the PEM method and the family knowledge that was applied from the subclass pattern and the PEM model, which tells us to go for the developmental stage. So I did not go directly to this remedy from that method, but I went from the repertorization, then coming to the kingdom method, and from kingdom identification, and from kingdom identification I came to subclass, and the remedies, the cocculus and Staphysagrina, allowed me to go to the subclass directly. And by exploring the other remedies closer to them, I could come to the similiimum, which helped the patient throughout. So what I concluded was that though superficially the presentation of patient is found in many remedies, the basic core of the patient differentiates the remedy and we can reach the similiimum. Causative factor and the reaction pattern belongs to the core and helps individualization. Finer aspects of patient's core feelings help in remedy differentiation. And the marked feature of Menispermaceae is profound weakness with kidney and genitourinary complaints, which points to Pereira-Brava. So this is how Pereira-Brava was explored. The references taken are mentioned. So thank you all for listening to me.
So if you have any queries, you can post it in the chat box. It was a nice case, Dr. Joshi. You can
Thank you,
stop
Dr. Mita.
sharing.
Yes.
Nice. So if there are any queries, you can ask it here. Dr. Joshi, there's a question. Please explain pain and excitement.
Yes. See, he always gave this complaint that whenever he has any kind of pain, he gets very excited. He's very angry about it. And this was also confirmed by the wife. The wife would say that he behaves very differently. I don't know what happens to him. He starts getting very angry on silly things, which otherwise he would not even register. But when he is in pain, he keeps on getting angry on us. He does not like anybody and he tells us that you all leave me alone. So this is what I had taken as excitement during pain, because this is not the feature in his normal, when he is normal. So this is absolutely a feature which is along with the pain, and that is why that rubric was taken.
Yeah. So this seems so much like staphysagria. If we don't understand the excitement, we can take it as irritability, anger, pain during. So
Yes.
it is very near to the energy of staphysagria, which
Definitely.
also belongs to the same column, subclass 1, and almost ranunculus, right? So we just
Yes.
have to fine tune it here.
Yes, fine, exactly. And in fact, that was what now when you taper down to these remedies, which are coming very close and which have this common features, like Staphylococcus aureus had that. But now when we go to the finer, the core of it, Staphylococcus aureus is always very conscious about its honor. So because of to retain his honor, he will never behave in an irascible behavior, that he would where this patient of ours, he used to behave irascible. He used to tell everybody, go out of here, don't disturb me. This kind of a behavior is not available in Staphylococcus aureus, because he would not want to lose his honor. So
Right.
this was one, and in fact, even though Staphylococcus aureus was coming very clear nearby, because the organ affinity was also covered by Staphylococcus aureus.
Yeah.
But this behavior was not covered by Staphylococcus aureus, and that is what made me think that though the patient is coming very near to these remedies, but in spite of that, it is not covering the important feature of the patient, and that made me go for and look for some other remedy which will cover this.
Right. So this is how we come to lesser known remedies, right?
Yes.
Because it was covering the pathology. The whole of subclass 1, it covers the pathology of genitourinary area, right? We have learned this. We don't know this. But this fine tune is possible with PEM. And what we
Yes.
call them as lesser known remedies or the smaller known remedies, which we don't have a full picture. So once we know the location, that is his subclass 1, and then when we could see that he is now forced to take a role, right? That is what is many spermacy, that they cannot stand for a long time. Although he tried to stand taking up the father's role, but he was not able to face the world for longer time, and that's where he broke, right?
Yes,
And if
and in fact, that is what is the reason of his coming up with the complaints recurrent. It is a recurrent complaint.
yeah,
Before coming to me, he had taken treatment for this renal stones even earlier from other homeopaths. Every
hmm,
time the stones are expelled, but then he comes back with the same complaints, because
right,
that retention of that, as Dr. Meeta rightly pointed out, the retention of that ego is not happening. He is not able to sustain it. And I would like to share here that after giving Pereira Brava, he had his kidney stones have cleared up. His right kidney became normal, and his left was partially the stones did were there, but they started reducing in the size, and they subsequently showed very good result. And he did not recur with any of the stone complaints after that. So that also showed that how the sustainability in the patient is also coming up with the similiimum. So similiimum does not act only at the physical level, as we all agree to it, that it covers all the planes. And we will find this sustainability even at the mental level.
Right. So we could see his lack of boundaries, how he was ready to help others going beyond the boundaries. That is what made him inactive in the later phases, like, right? Because he did not have any boundaries. So we could see how subclass 1 patients, they fall into this trap of urinary complaints, genitourinary area. That is what we have taken in subclass 1, right? And also we can see this from aspect of he had this inflammation in his testes, which is orchitis. So this is a very feminine column, and he was forced to become a masculine, take the masculine role at a very less area, matlab very less age. So how the pathology and the inner age, they come together, and this helps us again. Even the pathology helps us to chart, to
Yes.
map the inner age, and the subclass and the column and the remedy.
And
So
we can also correlate this with the psychodynamics,
yeah.
as Dr. Smita rightly pointed out, that how the coincidence with the psychodynamics happens here.
Yeah. So because his lesson, this was his lesson, that he had to face the life. And life gives you this opportunity, the whatever circumstances you're attracting, it is there to push you to learn your lessons. He had to learn and face the life. He had to come into this masculine energy. He has to embody this masculine energy and face the world and take responsibilities. So how everything comes together beautifully, and these lesser known remedies, which we know only the pathology, right, Dr. Joshi, we only know the
Yes.
pathological aspect, but once we know the exact mapping, we can understand the whole case, the whole psychodynamics of the case. So
Yes.
are there any queries, any aspect?
And I
Yes,
would also like to
Maganjo, you
highlight.
can see the row age in this case. We could see that.
So I can speak a bit on it.
Yeah, yeah.
Yes.
So ranunculales falls in the school age and the adolescence. And when we see the school age, the adult cycle, it comes to mature adult and the late adult. And very clearly, you could see in the patient how mature adult and late adult role he had taken in for his family. So this is so beautifully seen in the row age as well. So you talked about the column age. The row age is also beautifully mentioned here.
Yeah.
Yes.
So that's excellent. Thank you so much, Dr. Joshi.
And
So
thank you, Dr. Maganjot, for highlighting it so nicely.
Thank you. My pleasure.
So thank you, everyone. I think we have answered all the queries. We'll be coming up with short cases so that you can, this PEM, we are trying to use PEM in acute cases also. Right, Dr. Joshi? We are trying to
Yes,
use
yes.
PEM from retrospective perspective also. If we give a pace, we just, in repertory chart also, we use this PEM. So you can go from either way. You can go from PEM and then come to a remedy, or if you are getting a chart, you can rule out, this helps you to rule out the remedy by seeing the inner age. So
Yes.
thank you so much, Dr. Vaishali. Thank you so much, Dr. Maganjo. Thank you everyone for joining. And please give your feedback so that we can improvise on this and we can come out with the best. So this is an endeavor to bring out the best in our students who are just starting to practice these concepts.
Thank you. Thank you very much, Dr. Joshi. I think it was a very, very nice way of looking at. We never would have thought of Pereira. Absolutely.
Yeah.
Thank you so much.
And
Thank
many
you
a
very
times
much.
what we do is, when we come to remedies like this, we think that this is an acute remedy and now we have to work out the constitutional.
Absolutely.
Yes.
Absolutely.
So
Absolutely.
this breaks that mindset of giving an acute remedy or giving a constitutional. How these smaller remedies can be your constitutional. So this was just a glimpse,
Yes,
right?
precisely. In fact, after treating that orchitis with Pereira Brava, that is what made me think whenever he came down with his chronic, that hydrocele thing, then that was not his chronic complaint, but when that acute came up, and then subsequently even the renal colic picture, when I could match, it was matching with many with Pereira Brava. So
Pereira.
yeah, and that is why my point, that you get confidence in your remedy from PEM method. That also comes from here. That now I was very sure that there is no other remedy other than Pereira Brava which will take care of his constitution.
That's
So
so
I would not even want to go for a constitutional now. I said this only is going to take care of me.
Yeah, so it was a good learning that we don't have to come out with constitutional remedies. You know, these lesser known remedies can be your constitution. It's only because we don't have enough mental state. But here we don't need not go to that mental state also. We understand from his life space, the situation he was.
Yes.
This is what we used to learn as situational materia medica before.
Yes. So in
Thank
fact,
you very much. Sorry.
yeah, so in fact, the learning of a rare remedy also becomes evident from these kind of cases, where retrospectively, when you want to explore more from the patient, then you will get what is the picture of this remedy, and probably we can bark on that.
Yeah,
That okay, this remedy could be the picture which the patient has shown us.
right. And
Thank you. I think that rubric of excitement with the pain, I think that is where the key was.
yeah, that
We
is
would have
very
missed that.
true.
We would have missed that. I'm so glad that you kept at it and worked on it. Thank you so much for sharing this.
Thank you. Thank you, everyone. We'll meet again next month, last week of Monday. Thank you,
Looking
Dr.
forward to it. Bye-bye.
Bye-bye.
Thank you all.
Thank you all. Bye-bye.
Bye bye.